Today, we're talking about something that affects every medical practice, yet often goes unaddressed: trust, or more specifically, the trust deficit between patients and their healthcare providers. Trust is the foundation of healthcare. Patients trust us with their health, their fears, and sometimes even their lives. But what happens when that trust starts to erode? What's the cost of not addressing a growing sense of skepticism among patients? And why do so many physicians and practice leaders avoid confronting these issues? We'll break it all down today. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 116, Addressing the Trust Deficit in Healthcare: The Hidden Costs and the Path to a Reliable, Trustworthy Culture. Welcome to today's episode of Medical Money Matters, where we dive deep into the business and operational side of medicine. Today, we're talking about something that affects every medical practice, yet often goes unaddressed: trust, or more specifically, the trust deficit between patients and their healthcare providers. Trust is the foundation of healthcare. Patients trust us with their health, their fears, and sometimes even their lives. But what happens when that trust starts to erode? What's the cost of not addressing a growing sense of skepticism among patients? And why do so many physicians and practice leaders avoid confronting these issues? We'll break it all down today. We're going to explore how a trust deficit develops, the hidden financial and emotional costs of ignoring it, and most importantly, what you can do to rebuild and sustain trust in your practice. Let's start with what happens when trust is lost. Patients who don't fully trust their physicians and providers behave differently. They question more, they hesitate, and sometimes they avoid care altogether. If a patient doesn't trust their doctor, they're less likely to follow through on recommendations, whether it's medication adherence, follow-up appointments, or lifestyle changes. And when patients don't follow through, outcomes suffer. They stay sicker for longer, their conditions worsen, and they often end up needing more intensive, expensive care down the road, sometimes just in the ER, and sometimes they need to be hospitalized. Beyond the direct health impact, trust issues lead to a silent but costly problem: patients leaving the practice without saying why. They may not tell you outright, but you'll notice a dip in patient retention. Maybe they'll switch providers, maybe they stop coming altogether. Either way, the financial hit is real. Every lost patient means lost revenue, not just from missed appointments, but from all the future care they would have needed from your practice. And then there's the reputational damage. Patients who feel unheard or dismissed don't just leave quietly. They talk. They tell their families, their friends, and perhaps most damaging of all, they post online reviews. A handful of negative reviews on Google, Yelp, or Healthgrades can tarnish a practice's reputation and make it harder to attract new patients or to recruit new physicians. In today's digital world, trust doesn't just happen in the exam room. It happens before a patient even steps foot in your office. But the damage doesn't stop at patient loss or bad reviews. A trust deficit also takes a toll on the team inside your practice. When patients don't trust the system, they're more likely to be frustrated, defensive, or even hostile. This leads to increased stress on staff, particularly the front desk and nursing teams, who bear the brunt of patient dissatisfaction. No one enjoys working in an environment where they feel unappreciated or constantly under scrutiny. Over time, it contributes to burnout, high turnover, and a toxic workplace culture. If you've ever felt like your team is constantly putting out fires, dealing with upset patients, apologizing for scheduling mishaps, handling complaints. It might not just be a customer service issue. It could be a trust issue. So, how does this happen? How do good, well meaning physicians who genuinely want to help people find themselves leading practices where trust is slipping away? One big reason is that physicians, by nature, are both highly trustworthy and conflict avoidant. Most doctors enter medicine because they want to help people. They assume that their good intentions, their hard work, and their medical expertise should be enough to earn patient trust. And for a long time, that was true. There was a time when doctors were automatically trusted because of their position and title. But times have changed. Patients today are more informed, more skeptical, and rightfully so, more discerning. Trust is no longer assumed, it has to be actively built and maintained. But here's the problem. Most physicians are trained in medicine, not in the psychological nuances of managing trust. And because they dislike confrontation, many doctors don't address trust issues head on. If a patient is frustrated, many doctors assume, well, they're just having a bad day, rather than wondering, did something in our process create this frustration? If a patient leaves the practice, they assume maybe they moved or found another doctor closer to home, rather than thinking, was there something we could have done differently to keep them here? Even when trust issues are noticed, they're often framed as one-off problems rather than systemic issues. A doctor might think, that patient was just difficult, instead of asking, are our systems causing unnecessary friction for patients? This is why trust deficits grow quietly over time. They don't happen overnight. They happen through a series of small, unnoticed breakdowns. Delays in the waiting room, confusion over billing, rushed visits, inconsistent messaging from different staff members, an unprofessional exchange. The good news? Trust, once damaged, can be rebuilt, but it requires a proactive approach. Let's talk about solutions. You're listening to Medical Money Matters, a weekly podcast brought to you by Healthy Practices, a healthcare consulting and revenue cycle company dedicated to keeping our clients independent. Please reach out if we can do anything at all to support your practice. You can find more information online at healtheps.com. That's www.healtheps.com. Please follow or subscribe to get all future episodes downloaded as soon as they're released. First, recognize that trust isn't automatic. It has to be earned and maintained. A good place to start is by measuring where you stand. Gather patient feedback, whether through surveys, online reviews, or direct conversations. Pay attention not just to what patients say, but to what they do. Are they returning for follow-ups? Are they referring friends and family? Are they dropping out of care unexpectedly? These are all trust indicators. Second, communication is everything. Transparency builds trust. Patients don't just want care, they want clarity. They want to know what's happening, why it's happening, and what to expect next. This applies to everything, from medical treatment plans to office policies. A patient who understands why there's a 20-minute wait is far less frustrated than one who sits in the waiting room wondering what's going on. A patient who understands their bill clearly is less likely to feel like they're being taken advantage of and more likely to refer their friends and family to your office. Training staff to communicate effectively is just as critical as medical training. Your front office team, your nurses, your billing department, every touch point matters. If one person in the process is dismissive or unclear, it erodes trust in the whole practice. Third, fix the systemic issues that frustrate patients. Do you frequently run behind schedule? Look at how appointments are booked. Do patients call with the same billing questions repeatedly? Your statements might need clearer explanations or a full redesign. Is there inconsistency between what the doctor says and what the front desk tells the patient? That's a training issue. Trust isn't just about being a good doctor. It's about running a reliable, patient-friendly system. And that starts with leadership. As a practice leader, you set the tone. Do you foster a culture where concerns can be voiced and improvements can be made? Or do staff and patients feel like they just have to put up with problems because they're afraid to bring them to you? Creating a culture of trust means making accountability normal, not punitive. When mistakes happen, acknowledge them, fix them, and communicate what's being done to prevent them in the future. Patients don't expect perfection, but they do expect honesty and effort. So what's the takeaway? If you're noticing more patient complaints, staff burnout, or declining retention, don't assume it's just the way things are. Look deeper. Trust deficits don't fix themselves, but they can be repaired. And the benefits are enormous, not just in patient satisfaction and financial stability, but in creating a workplace where providers and staff feel proud of the care they deliver. Here's my invitation to you. In the next 30 days, take one concrete step to strengthen trust in your practice. It could be implementing a new patient communication strategy, gathering more feedback, or addressing a process that frequently causes frustration. Small changes do add up. And if you want expert guidance on improving your practice's operations, culture, and patient experience, Healthy Practices is here to help. Thanks for listening to Medical Money Matters. If you found this episode helpful, share it with a colleague. Let's work together to build a healthcare system where trust isn't just expected, it's earned every single day. Thanks for tuning in to today's episode of the Medical Money Matters podcast. Before you go, let me ask you, are you ready to take your medical group's coding to the next level? Because that's where Code Mastery comes in. Code Mastery isn't just another coding program. It's the ultimate physician-to-physician training solution to maximize your revenue and empower your physicians with the skills they need to code confidently and win the coding game. From comprehensive high-octane training to actionable insights, Code Mastery gives you the edge you've been looking for. Don't leave money on the table. Visit healtheps.com/code mastery to learn more and take control of your coding today. Let's transform your practice's financial future starting now. See you next time on the Medical Money Matters podcast.